Welcome to the Workplace Minute, powered by H3HR Advisors and sponsored by Paychex, one of the leading providers of HR, payroll, retirement, and software solutions for businesses of all sizes. My name is Steve Boese. Employer-sponsored healthcare costs expected to surge in 2025. The average cost of employer-sponsored healthcare plans is expected to rise by 9% in 2025 unless organizations can find ways to cut down on those costs, according to a report by professional services company Aon. The increase will push healthcare plan costs per employee to over $16,000 annually in 2025, the report found. This year, employer insurance costs grew 6.4% compared to 2023, while average expenses per employee rose to more than $14,800. Inflation and the cost of more expensive specialty drugs are pushing healthcare costs higher, according to Aon. Expensive and popular glucagon-like peptide-1 drugs, or GLP-1s, increasingly prescribed for weight loss, are also projected to increase employer plan spending. In the U.S., about 60% of the non-elderly population, or about 165 million people, access healthcare insurance through an employer-sponsored plan. Of these, about 84 million get access from their own job. About 74 million others are covered as a dependent by someone within their household, and about 6.5 million are covered as a dependent by someone outside their household. And that's data courtesy of the healthcare consultancy KFF. On average, employers subsidize about 81% of healthcare plan costs, while employees pay the rest, according to Aon's data. But as healthcare costs rise, employers have shifted more expenses onto workers through higher premiums and deductibles. A recent survey by consultancy Mercer found employers plan to maintain their current health benefits next year despite these rising costs. But 45% of employers reported they were likely or very likely to shift rising expenses onto their employees. And that could make it harder for workers to pay for health care. Many Americans report delaying or foregoing care because of worries about cost, and having insurance doesn't always protect them from high bills. Additionally, many employers are still wrestling with coverage decisions around the previously mentioned GLP-1 drugs, which are surging in popularity and driving overall costs much higher for organizations, especially for larger organizations, most of which are self-insured at this point. A large percentage of workers could be eligible to take these weight loss medications, but they are expensive, and early studies show they only remain effective if patients continue taking them indefinitely. According to a statement from Aon, the demand for GLP-1 medications has skyrocketed, and a surge in the new drugs in the GLP-1 category is expected to drive up costs even further, adding 1% to the aggregate healthcare cost increase. As employers complete the work of setting up their employee healthcare plans in preparation for benefits open enrollment season, many, if not most, will have to find the optimal balance of providing high-quality and cost-effective plans to their employees while managing their overall costs to ensure plan and even employment sustainability. Employers want to absorb more of these annual cost increases if they can and attempt to shield employees for these effects. But increasingly, that's become difficult for many employers. It will be worth watching to see if that trend continues into 2025 in the face of these higher than expected cost increases. We will continue to follow benefits in healthcare and all the important topics and trends in the world of work here on the HR Happy Hour Media Network. That's it for the Workplace Minute, powered by H3HR Advisors.